I believe everything happens like for a reason. Like there's no coincidence, and like this, the timing of this, it worked out the way it was supposed to work out. And I don't know how that worked. They didn't teach me in medical school how that worked, but I know that it does. And so it was no coincidence that my last week of medical school, I was doing a family practice rotation, and this patient came in. She was really sick. She had been having 3 days of nausea, vomiting, dry heaves, and couldn't keep anything down. I saw her. I went in and saw her. Didn't really know what was going on, but she was pretty dehydrated and stuff. And so we decided to put her in the hospital, give her some hydration, and do some tests. So we ran some standard tests, and over 3 days, everything came back normal. She was feeling pretty much, better, although still a little peaked. And so I went in to discharge her, and sat down. I was writing some discharge orders out. And I made some corny kind of small talk, and I said something like, well, we're going to get you home where you can get some real rest because you can't rest in the hospital. And she says, well, I wish. I said, you wish? What do you mean you wish? She said, I wish I could go home and get some rest. And I said, well, why can't you? And she says, well, in the last 6 weeks, my husband left me, my dog died, and my house burned down.
Unbelievable.
Fortunately, I was sitting down, and my first thought that came to me was, well, no wonder she was so sick.
This is Uncommonly Remarkable in Conversation. Ladies, gentlemen, all you remarkable people, please welcome Dr. Julius Torelli to the show. When we first started talking, we had all these things that kind of got in the way, right? So we wanted to schedule, then there was some weird thing, and then there was COVID that ran around here in the house, and we were like, oh, we can't do that. But now here we are. Yeah. And so, we've been talking a lot on the show about healthcare, wellness. We've talked about everything from mental health to physical health. We've talked about exercise. We've talked about medications. We've talked about Chinese medicine. Like, we've been all over trying to understand how we can take better care of ourselves. And so I think the topic today is going to fit right into the theme that we've had over the course of the last several months. And so why don't you take a few moments and introduce yourself, and let's talk a little bit about what it is that you do today.
Well, I'm a cardiologist. We'll get into my story, but which has been a journey. It's been quite an evolution and sort of a transformation of my practice. But today, I started a company called Gratefully Well back at about the beginning of the year, and the idea of Gratefully Well is to try to take what I was doing in practice one-on-one with patients and trying to transform that into this educational digital space, digital platform that is, look for people basically that are looking for these kind of resources and support.
And when we talk about how we start to think about people and their wellness, and we're looking at how people can actually contribute to or control some of what goes on to them. This is a concept that is not necessarily new, but one that's kind of overlooked. And when did you really start thinking that this was a direction that you should go in?
Again, it's sort of an evolution, but I will say I believe everything happens like for a reason. Like there's no coincidence, and like this, the timing of this, it worked out the way it was supposed to work out. And I don't know how that worked. They didn't teach me in medical school how that worked, but I know that it does. And so it was no coincidence that my last week of medical school, I was doing a family practice rotation, and this patient came in. She was really sick. She had been having 3 days of nausea, vomiting, dry heaves, and couldn't keep anything down. I saw her. I went in and saw her. Didn't really know what was going on, but she was pretty dehydrated and stuff. And so we decided to put her in the hospital, give her some hydration, and do some tests. So we ran some standard tests, and over 3 days, everything came back normal. She was feeling pretty much, better, although still a little peaked. And so I went in to discharge her, and sat down. I was writing some discharge orders out. And I made some corny kind of small talk, and I said something like, well, we're going to get you home where you can get some real rest because you can't rest in the hospital. And she says, well, I wish. I said, you wish? What do you mean you wish? She said, I wish I could go home and get some rest. And I said, well, why can't you? And she says, well, in the last 6 weeks, my husband left me, my dog died, and my house burned down.
Unbelievable.
Fortunately, I was sitting down, and my first thought that came to me was, well, no wonder she was so sick. That was my first common sense, intuitive sort of realization awareness. My next realization was, wait a minute, I'm finished with my medical school education. It was my last week, and I've never heard about this. And not only haven't I heard about it, I'm not even sure what it is. Like, is this something that's even real? And I said, well, I've got access to a whole medical school library, and I could go in there, and I'm not even sure where to go look for what this is. And of course, if I don't know what it is, how do I treat it? So I was all confused. I didn't know. My mind was a sort of a whirl, and it was a busy time. I was in Tampa. I was in medical school. We were packing up. We had to move up to Cleveland to start my residency, and so. But that patient stayed with me throughout my training, then in residency and fellowship, and I saw this then over and over and over again, and so it became. Even when I got into practice, I started to see that the majority of people who come in to see the physician with chronic complaints, chronic symptoms, we didn't normally find anything physical, right? So when they come in with headaches or neck ache or chest pain or belly pain or muscle aches or fatigue, most of the time the tests come back normal, and we give those a name, like migraine headaches, or which means it's not a tumor or something else causing your headache, or irritable bowel syndrome, or non-cardiac chest pain, or some kind of palpitations, or chronic fatigue syndrome, or fibromyalgia. We give these things names, and then we treat it. And we have in medicine our toolbox really is limited. So when you open up the toolbox for Western medicine, the first tray is procedures. So if you've got belly pain and you've got appendicitis, we can go in and cut out your appendix, and it works. We can go in, if you're having chest pain, you're having a heart attack, we can go in, open the artery up, and that works, right? So when we can find something physical, we're pretty good. In fact, we're really good. The problem is, again, most of the time if we don't find anything physical, then you take out that tray in the toolbox, and the only other thing left is what? Pharmaceuticals, right?
Yeah.
And so physicians want to help, but again, we're limited to now pharmaceuticals. And so you have migraine headaches. We've got great medicines to prevent migraines. We've got medicines to treat migraines. If you get the migraine while you're on the preventive medicine, maybe you're a little bit depressed, so we got something. Maybe if you're depression, maybe you're not sleeping well, we'll give you something to help you sleep. Maybe you're anxious, and we give you something for help you with anxiety. But the truth is, we all know that there is an emotional component to the migraine headaches or to the irritable bowel. And I call it an emotional component. We would call it stress.
Yeah.
Right.
Yeah.
But I think there's an emotional component, and we don't. The issue I have is we don't deal with that foundational issue. We give you the medicines, and we don't look at that. Emphasize the lifestyle issues and things like that.
Well, you said a couple of things that maybe I want to pull on just a bit. I mean, I think one of them is the nature of chronic disorder, right? And people who have a string of chronic, long-lasting symptoms, and how a lot of those are very hard to track down and put a name on. So we kind of say, okay, we've excluded all the things that we know we can exclude. Must be what it is. In the world of optometry, there's an ophthalmic migraine is one of those things that you're taught in school that it could be that, but you got to rule out all these other things first, right?
Absolutely.
And so.
And that's very important, just to interrupt you, sorry. But a lot of people say, you start to think about these stress-related issues. But the first thing is you do have to have an evaluation to make sure you don't have a brain tumor, or make sure that you don't have, a Crohn's disease or something causing your belly pain or things like that. Like make sure you don't have heart disease causing your chest pain. So, but that first thing has to be ruled. The physical stuff does have to be ruled out.
And I think that's the part that's really hard, right? Because you're going through all your everything that you're going through it scientifically, you're ruling out all these things, and the patient is staring at you waiting for you to have a diagnosis, right? And you really want to give them one because you don't want to disappoint them, but more so you don't want to disappoint yourself and that you couldn't figure this thing out. So how do you start thinking about that as you're dealing with these patients that you weren't really able to put a name on?
It's very challenging. It's challenging for both sides. I think it's challenging for the provider. It's challenging for the patient as well, because most patients come in with migraines. They want you to find something. They want you, but they don't want. But then I tell them, you don't really want us to find anything because if we do, it's not
Not
good,
good.
right? And so there's this thing that becomes difficult, and so absolutely we have like when we find something. I wouldn't say we're excited about it because it usually isn't a good thing, but at least like we're like, oh, we found this is your problem. But again, the great majority of the time when we don't, professionally, it's not satisfying, and I think for the patients, it's not satisfying. So it can be very, very difficult, and that's why physicians that's why we give it a name, right? That's
Mm,
why we call it irritable bowel
yeah.
syndrome. We don't say this is just you got belly pain because you're nervous or because you're anxious or
Yeah.
because you're stressed. We don't, it's better to give it a name, and of course, once you give it a name, then you can give medicines for it and things like that. And I don't actually have problems with the medication either. You've got migraines and they can prevent or treat the migraines by all means. That's fine, but in addition to the medicines, we should be looking and dealing with this emotional component.
And so if we were to go back and kind of think about then how you got started in medicine, was there something, was there an impetus? What got you interested in going to medical school in the first place?
It's a great question. I've not ever remembering wanting to do anything else. I never wanted to be an astronaut or a fireman, and I always wanted to be a physician. The one thing that I remember probably the most, especially as a teenager, was being fascinated with human behavior,
Mm,
and I loved I just understanding why we do the things we do. And why we don't do the things we don't do. And there was a part of me that really, I grew up in a fairly western Broward County in Fort Lauderdale. It was a little bit of a rough area, and there was some crime and things like that. And I couldn't understand like crime, especially like petty crimes, like vandalism, as an example. I'm like, how is this fun? Like you just keyed this guy's car who you don't even know, like how, you know what I? And so there was this fascination, and so I did a lot of psychology. Psychology was my minor. I majored in chemistry because it came easy, but psychology was my minor. And I actually thought about, counseling, psychiatry, things like that. And didn't end up doing those for I don't know why.
mm.
I felt drawn to cardiology, but that was one of the impetus. It was understanding people, and that's always been my fascination with all of medicine.
I asked that question because when we think about the number of physicians out there and the work that they do, not all of them start to connect these patients with these abstract symptoms and the story of your last couple days before being out on your own, right? And so I just wondered what was drawing you to even ask those types of questions or engage in that type of conversation with the patient to really get your brain thinking about it that way, and so that interest in how people think is pretty cool.
Yeah, I'm a little odd that way. So most physicians, again, we've concentrated essentially, let's just call it 100% on the physical, because that's where all of these symptoms obviously manifest, right?
Hmm.
And in medical school, we don't. I like to think of these non-physical dimensions of health that we don't deal with in Western medicine. So we deal with the physical and we do that well. But again, if we don't find anything, there are other aspects, there are other dimensions of health like mental health, behavioral health, emotional health, spiritual health, social health, and cultural health, and that we don't pay any attention to these. We do better today than we did 20 years ago,
Hmm.
but even so, we still, I think, have a long way to go.
So, the it's just for me interesting, and people have asked me multiple times, how did I get into being an optometrist?
Yeah.
And like you, I think I was going to be an optometrist since the fourth grade, right? And so I was in an art class, just kind of as an aside, and we were going to have a show, and the teacher was telling us where the show was going to be because I grew up in rural North Carolina, and the school where we were was kind of out in the county, and the art show was going to be something that was collective, and it was going to be in city limits, which was a big deal. And so we were writing down the address for where we're going to go, and I was misspelling it terribly, apparently. And the teacher goes, "Well, it's on the board." And and I go, "Uh-oh," because I didn't know that it was on the board because I couldn't see it. So my first doctor's visit that I can actually remember, and so was going to an optometrist. And when I got glasses, I was able to see leaves on the trees. And
Yeah.
so, believe it or not, until fourth grade, I did not actually realize that the leaves that were on the ground in the fall were the same leaves that were on the trees in the
Wow.
spring because I couldn't
Wow.
see them
Yeah.
that way, right?
Yeah.
And that day forward, I was like, I'm going to be an optometrist. I'm going to do this. I'm going to help people. And it was an interesting journey to get there. But along the way, there were lots of things that maybe I thought about differently,
Right.
like you did. And this changed my approach or the way I think about interactions with people and interactions with patients. And this whole concept of your mind being able to contribute to the way that you feel and symptomology is just very interesting to me.
Yeah, it's another thing that just again fascinates me in that in Western medicine we look again at the physical and we always look for these physical what could be causing this, and we know because we're taught that there's a mindset perspective, right, or a
Mm,
thought perspective or belief perspective, and we're taught it because we're taught about the placebo effect, right?
mm,
And we know the placebo effect exists. We know it's a real thing. Pharmaceutical companies hate it because it's a pain for them because
yeah.
they have to do all of this studies to millions and millions, hundreds of $1 million studies sometimes to show that their medicine works better than a sugar pill,
Mm-hmm.
right? But yet we look at the placebo effect as an example. We know it exists, but we look at it more as a nuisance than we look at it as like when I heard about the placebo effect, I was like, oh man, how do we amplify this?
Ah, yeah,
Right?
yeah.
Like this is cool. This is like, and so, but it doesn't take much, right? When you start to think about it, if you say, you're somewhere at home alone at night and you're going to bed and you're falling asleep and you hear this noise downstairs and you're like, oh, what was that? You get startled, right?
Mm-hmm.
What happens in your body? Like when you get started, your heart's racing a little. If
Yeah.
you measured your blood pressure, it would be up some. And then let's say you go, gee, and then all of a sudden you have a thought, gee, I wonder if someone broke in. Now your heart's racing faster. Now your blood pressure's higher. Your pupils dilate to let in more light. And believe it or not, things like your hormone levels change. So sugar goes up and things like that. So you have more energy. And then you go downstairs and you find, let's say, I don't know, a broom fell over and knocked over some stuff and made that noise. Um, so so you lay back down, you kind of relax, and you're eventually able to fall back asleep. But the physiologic changes that occurred, not because someone broke in, because of the thought that someone broke in, but the changes are exactly the same as if someone had broken in. Right? If you think about a lemon and you sort of concentrate and you picture this lemon, you picture slicing a lemon and you picture biting into that lemon, you'll salivate. There's no lemon.
That's so powerful because we've all experienced that,
Yeah.
right? Like we've all had moments where you thought something was going to happen
Yeah.
and it really wasn't.
Yeah.
But you went through the entire cycle
Yeah.
of, is it happening? I'm afraid it's going to happen. What am I going to do because it's happening? Oh, wait, great. It didn't happen. But that didn't change any of the
That's
things
exactly
that
right.
already got you amped up about
Mark
it.
Twain has a great quote. I can't quote it because I can't remember exactly, but something to the effect of, "I'm an old man and I've had many worries and seen many terrible things. Most of them never happened."
Mm. Well, but that really does speak though to how it's possible that the way you think about things has a large effect on the way things actually come out, right? And I think your point around the hormonal changes, the other physiologic changes, thinking somebody broke into the house,
Yeah.
if you put yourself in a spot where that thought pattern is the dominant pattern you have over a long period of time, it means that you've got elevated blood pressure
You got
all the time. You know,
you got it.
you've got weird blood sugar all the time,
You got it.
and so that's where those thoughts can really make a difference.
Yes, you hit the nail on the head. That's exactly right. So if you think about those in that acute situation, it's no big deal, right? But if you're chronically always worried about not someone breaking into your house, but you're worried about where you live and you're worried about your family and stuff. Maybe you live in a rough area and you like And we've got those studies. I mean, if you look at inner city children, blood pressures are higher in inner city children than they are in outside, in a more rural area, more suburban area.
Wow.
Yeah.
Wow. And so then let's talk then about how we approach helping people understand these thoughts and maybe how we think about mitigating some of them in an effort to reduce long-term changes that could be detrimental.
Yeah. Well, again, very challenging because we have, as a society, been taught, as you alluded to earlier, you wake up in the morning, you're not feeling well. Let's say you have a headache, maybe they're recurring headaches. You do your normal thing. Take some Tylenol, take some Advil, whatever it is, doesn't get better. Maybe it gets worse. Like I said, maybe they're recurring. You finally decide, I've got to go to the doctor. It's the worst headache I've ever had, or these that keep coming back. You go to the doctor, and as you said earlier, you expect two things. You expect him first to figure out what's going on, and then you expect him to fix it.
Mm-hmm.
So we put, as a society, we put generally 100% of the responsibility for your health care onto the provider. So the provider sees you, says, does maybe an MRI, there's no brain tumor. Now we're going to put you on this medicine. And you go, okay, great. But again, you never get to sort of that root cause because he's responsible for everything.
Mm-hmm.
It's, I think, even worse in a situation like diabetes. So if you take type 2 diabetes, which is absolutely epidemic right now, right?
Mm-hmm.
Yes, you do have to be genetically predisposed to diabetes. Okay, that's a given. But you can modify the expression of those genes based on your lifestyle. So you go to, but because in our society, everything is, the doctor's responsible for all your health care. So you go to the doctor, he says, your blood sugar is chronically elevated, your hemoglobin A1C is high, you have diabetes, we're going to put you on these medicines. Again, nothing against the medicines. Today's medicines work much better than they did 30 years ago, where they didn't even do the right thing. They were making you make more, like sulfonylureas make you make more insulin. That's not the issue. The issue is the insulin's not working well. At least today, the medicines do work better. They do the right things. So that's good. No problem with that. However, then he'll tell you, oh, you need to lose some weight, you need to exercise, so you need to go on a diet, you need to exercise, whatever. You hear those things, you're like, he's got me on the medicine. I'm just, you're going to take the medicine. And if that works for you, like that's all you want to do, that's fine. But the medicines are not going to cure your diabetes. They will make the pharma industry very wealthy, but they will not cure your diabetes. However, you can improve your diabetes. In fact, you could potentially cure your diabetes by making those lifestyle changes. And so, but you have to kind of introduce this, and you have to, I think, soften the message a little bit. So, for instance, like in my case, I never talk about exercise. Because when you talk about exercise, a lot of people think, I got to go to the gym, I got to get on a treadmill, I got to lift weight. I don't want to do all that kind of stuff. So instead of saying exercise, I say live an active life, right? So you have, especially if young people, especially have children, are like, I don't have time to exercise. I don't say, okay, well, what if you guys get bikes and you go and ride bikes together? That's an active lifestyle. That's exercise. And you're doing it with your kids and, and that kind of stuff. I tend not to use the word diet because, again, people will assume or equate that with weight loss, which they need to lose weight. But we talk about nutrition, learning about the food that you eat and learning, what kind of food you should eat. Why aren't you? What are you eating that you shouldn't be eating? And then even I think another layer is even why are you eating the way that you're eating, right? And so because there's a lot of nervous eating, right, or stress-related kind of eating and things like that. So you have to kind of introduce it in that way. Again, I'm not saying don't take the medicine. I want to make sure that everyone understands that. But in addition, right? So the first thing that has to happen is, I think, as a society, I always say it's easier to cure an illness if you never get it in the first place.
Absolutely.
Right? We all believe that.
Yeah.
We all know
absolutely.
that. It's just intuitively obvious, right? However, the Western medical model, everyone says the healthcare system is broken. I'm like, it's not really broken. It's the healthcare system is an illness-based fee-for-service model. That's what it is. It's got its pros and its cons, advantages and disadvantages, weaknesses and its strengths, right? Every model does. Right now, the weaknesses are showing up in the healthcare system because the costs are just off the wall because it's this illness-based fee-for-service model.
Yeah.
And it's a
Yeah.
big model, okay? It's $4+ trillion model. So how do you change that? How do you, we don't know. We know a ton about disease. I mean, if you look at the inflammatory cascade in lupus or in rheumatoid arthritis or something like that, I mean, we understand these hormonal, these all of these changes that occur to a very detailed degree, but we know very little about prevention. In fact, when you talk about preventive services, it's kind of funny because you say, what do you mean preventive services? What do you do? They go, oh, well, we do mammograms and PSAs and colonoscopies. I'm like, well, wait a minute. I'm all for mammograms, but mammograms don't prevent breast cancer.
Yeah.
PSAs don't prevent prostate cancer. Colonoscopies don't prevent colon cancer. These are all important. These are early detection. So we don't even know what prevention really is. Outside of vaccines, we know very little about prevention.
What an incredible point, though, because that's when you think about your third party insurances, that
the annual physical.
Yeah, like all of those things
So
fall
look for
into the
stuff.
preventive
Yeah,
piece,
yeah.
right? Because you get the notification. Well, you're gonna be 45. You're gonna be 50. Here are the things that you should do to make sure you don't have any of these troubles. But the reality of it is, they're really there to detect the trouble early and not necessarily prevent you from having the trouble in the first place. I mean, even when you go for your annual physical, it's you think, oh, I'm going here because I'm making sure that I am well. But on the other side, I mean, you would be looking at all the things, making sure that you didn't see any of the bad stuff, right? Like it's not necessarily
How
making
many
you better.
people? How many people in the United States do you know that wake up in the morning? I'm feeling really good. I want to make sure I continue to feel good. I'm going to make an appointment to see my doctor and see everything I have to do to continue to feel well. Nobody does that.
Nobody.
Nobody. Our system is not set up that way. Now you can go outside of the healthcare system and find things that you can do, nutritional stuff that you can do, yoga and meditation, and you can find it's outside. So should that be in the healthcare system? I don't know. I think so, but whether it exists or not, but as a healthcare system, we know very little actually about prevention. Now it's changing. People are becoming educated and getting into it, but that's still a very small percentage of the population that does it.
Well, and the point around medication and why it's important, I think, is one that we can talk about a little more because you it, we need medications. Medications do a lot of things that on our own we would not be able to do, and one of the examples that I think about most often is in patients that have mental health issues, and this thought around neuroplasticity and the fact that medications can sometimes make it easier for talk therapy and other therapies to help make changes in the brain that long term can be very healthy for the patient. To your point, they're not curative, but they may be able to facilitate you getting into a better place, doing the other things that you've taken responsibility to do to get you there, right? And so when you think about the role of medications versus the role of personal responsibility, how do you mesh that so that people can kind of understand how much of their healthcare should be them taking responsibility for things and how much of it should be based in the science of pharmaceuticals and things that are used to help get them there?
So again, I think diabetes is probably the easiest and best example of this. Mental health is actually a good example as well, but we'll stick sort of the diabetes because it's a little bit easier. So you go to the doctor, right, and let's just say he says you have diabetes. He says you need to be on these one or two or three medicines, whatever it is. Then it's very important to do because the medicines are going to start doing the right thing. But again, what I think sort of needs to happen is you need to understand the doctor. And again, the doctor doesn't get paid so much for his time, right? He gets paid for seeing you and doing the sort of the things that he does. And so he's got 6 patients to see that hour. He doesn't have time to educate you. And you don't, as a physician, you don't get paid, even though physician means teacher. There's not you don't get paid for education, and so you don't spend a lot of time doing it. So you tell patients you need to lose weight, you need to exercise, right? And again, most patients don't really even know where to start with all that kind of stuff. And so people can educate themselves. There's a ton of information, and you can do that. But again, it takes a lot. I personally, we had counselors in the practice, we had nutritionists in the practice, and we would send patients to see these people, and they could begin to understand making lifestyle changes that are key. These are important, and you emphasize how important this is. But you start off really small. You start off with small changes and go, just how many sodas are you drinking a day? 6. Okay. Can you get rid of sodas? Well, no, I can't. What am I going to drink? And so you start and you make these sort of small changes. How much processed foods are you eating? Why are you eating processed food? A lot of people eat processed food because it's convenient more than it is anything else. What can you do to sort of, and so maybe you can cook like what I do. I cook a bunch of stuff on the weekend, have throughout the week and things like that. So you can start to introduce and help people understand this stuff because everyone's busy. And so anything you can do to help with those lifestyle changes, like I said, exercise doesn't mean you have to go to the gym.
Yeah,
right?
that's
You can
right.
go, I like to landscape. Well, I pay someone to do my landscaping, then I got to pay to go to the gym. It's like,
Well, God bless you on the landscaping because if it depends on me to help it live, it's just not going to happen.
Well, no, I didn't say I like landscape. I meant that.
Well, so so as we kind of think about um, being mindset as being kind of a driving force, um, I think there are lots of things that you can think about from a how do I influence myself more positively, right? So if we go back to the example of thinking. You would not want to spend your life worried that you're going to have to defend yourself at any moment. Doing that chronically would be bad. But there are lots of other things that can be that way. So there's kind of depression or being down on yourself or having anxiety or being angry or these emotional responses that cause a physiological change. And so how do you counteract that? Like how do you think about, man, I'm in this situation, this is not, now I understand this is not good, how do I redirect myself?
Yeah, so it's a great point, and a lot of what Gratefully Well I would sort of try to emphasize within Gratefully Well, and so I let's take migraine headaches because we've used that. I personally think everyone with migraine headaches should see a counselor.
Mm,
Right. Or if you're a physician, you do the counseling, of course, but most of us are not trained as counselors, and so we don't have the time. But again, the medicine is fine, but you should, in addition, be seeing a counselor to deal with these, lifestyle sort of issues. And so part of the problem in our society is, again, we have this doing kind of thing, this thing that we always have to be busy, we always have to do, and we're stressed. Again, I like to call it emotional sort of issues, and so people need to learn how to relax. So if you look at smokers as an example, if there are some differences, but the majority of people smoke to relax. So right, and so if you sort of say, hey, like, what if we taught you another way to relax, right? A
mm.
lot of people. I was in New York a couple of weeks ago. Half the city smells like weed half the time. Like people out open, people are on their work break, out smoking a joint, outside their work or whatever. And it's like, what? And if you talk to them, it's kind of like, yeah, well, it just helps me chill. It helps me relax. Well, I don't really have a problem using that and relaxing, but if that's the only way you can relax,
Yeah.
that's a problem. And you can sort of do that. So getting people to start to understand, you don't have to go sit in a lotus position and meditate to relax. That's a great way to relax.
Mm.
And you can meditate without sitting in a lotus position. You can meditate as if you say, well, I can't sit that long. You can do a walking meditations, and you can do other things. You can do things mindfully, which also helps. And so you start to help people sort of see these things and see how important it is and say, hey, you have to learn to take care of yourself because, again, the doctor can't change your lifestyle. He can
Yeah.
give you the medicine, but you have to take some responsibility about the lifestyle. He can't make you walk. He can't make you eat certain foods,
Yeah.
right? But I think have the responsibility to teach people and help them understand.
And gratefulness is one of those things, gratitude is one of those things that is fairly easy to do even on the fly, right? Um,
Super.
and it's interesting for me to think about gratitude because um, I've talked to some really impressive people over the course of the last couple of years, and one of the common themes is that those people tend to have gratitude. They are grateful for things that you don't necessarily think about as being grateful for, but once you start to kind of unpeel it, you're like, well, yeah, that makes a lot of sense. And it's not just, hey, I'm grateful for this. It is being in a place where they understand how this thing, whatever it is, interacts with them and touches other people, and they're able to then diffuse whatever situation they're in and then concentrate on whatever it is that they need to get done,
Right.
which is absolutely amazing to me. And I think that's one of the things that um, it seems easy to do until you start doing it, and then you realize I've got to work at it to get it to really truly get it to work. But then it starts to open doors.
Yeah. So again, remember I was traditionally trained in Western medicine, right? So when I started to try to say, um, try to get more into I call this a holistic approach, to a patient or in medicine. And I said, and if you start to think more about wellness and prevention, I was like, I don't know anything about wellness and prevention. And so I started to have to look outside of the healthcare system to try to start to learn something. And one of the first things I came across was gratitude. And there's actually literature, there's a whole body of scientific evidence that shows the physical and mental health benefits of gratitude, which is what my book is about. That's on Amazon. It's all about the the evidence that exists between the mental and physical health benefits of gratitude. And so, and there are many ways to do gratefulness or gratitude, right? So gratitude journaling is a big thing, right? So just write 3 or 5 things every day in your thing, and those are powerful. I'm not going to discount that, but a lot of people say, yeah, I do it, but I don't really get much out of it. And I sort of say, well, it's not just the quantity of the gratitude; it's also the quality of the gratitude. You're like, what do you mean? I said, well, like if imagine you're going to sleep and you're like, oh shit, I forgot to do my gratitude journal, and you pop up and you go, oh, I'm grateful for my family, and I'm grateful for whatever. Does that have an effect? Yeah, maybe, right? But as you said, you can also do gratitude. The problem with the gratitude journal is you have to, it takes time, and
Yeah.
everyone's always talking
Yeah.
about how you got to sit down, you got to get a journal, you got to take the time and do it. And you could do this. And this is so I have a technique I call intentional gratitude using the trace back method. And so this I try to use this to amplify that gratitude. So again, like if you're stuck in traffic, right?
Mhm.
Or you're in the grocery store and you're in the slowest line and you're in a rush because it's always the slowest line, right? But if you're stuck in traffic and you're going to be late for your meeting and you should have left earlier, right? So my general reaction would be anger toward myself. I'd be beating myself. I should have left earlier. I should have, but that comes out as anger toward the traffic or whatever, right? So when I'm sitting there angry, I can't do anything about the traffic. It is what it is. I'm going to be late, and that's sort of is what it is. And so I can sit there and fight against it. And in that case, the physiologic response is going to be what? It's going to be that's a stress response or
Right.
a fight or flight response. So your blood pressure are going to release all of these stress hormones, right? The sympathetic nervous system, all of these hormones like adrenaline, noradrenaline, and things like that. That's going to do bad things to you, raise your blood pressure, raise your heart rate, all this kind of stuff, right? You're doing that to yourself. Now you can blame the traffic. You say, no, the traffic's doing it. Well, no, because the traffic is there, and you could just as easily sit there and say, okay, take a few deep breaths and say, there's this. Um, my car. It's 97 degrees outside, and my car has air conditioning. I thank God that I have air conditioning.
Praise
Right?
be for the air conditioning.
Yes,
Yeah.
I've got this great radio, and there's this podcast I've been wanting to listen to called "Uncommonly Remarkable," and I got time to listen to it now.
Right.
And you can listen to the podcast again. That doesn't, and then kind of amazing things happen when you do that because all of a sudden the traffic starts moving. I don't know how that part works, but but I know from the mindset, the thought part, that all those things, those thoughts, lower your blood pressure, lower all those hormones that are causing all of that physiologic response. That can be done again on the fly. I also learned over time that perception, the way we perceive an event, is not a given. You can choose how you perceive an event, and you can change that perception. And so I realized this 30 plus years ago when I was talking with I had a friend who I worked with who had adopted a child, and it was a 2-year-old from Romania. And they had brought the child back, and they had taken time off to be with the child. The mom took like 6 weeks off of maternity, and he took a couple of weeks off. And then a couple of weeks before she was going to go back to work, they started to introduce the child to the daycare that they were going to take him to. So they went the first day, and everything was, they say, it sat there, and he interacted with the kids, and it was fine. The second day, the teacher said, okay, now why don't you just leave and go outside just for like a minute and then come back?
Mm-hmm.
I said, okay. So they went to get up and to leave. The child saw them leaving, and he had a fit. He had an absolute meltdown. They came back, of course. Mom went over and did the mom thing. Oh, forget it. I'm just going to quit my job. I'm never going back to work. I'm going to stay at home and I take care of you. Excuse me. And she was all distraught. My friend was like, I was elated. I was like, elated? The hell is wrong with you? Like it's some kind of weird. He goes, no, you don't understand. He said, my biggest fear in adopting this 2-year-old was that he would never bond with us. And I realized he bonded with us, and I was just overjoyed. So he's keep talking, and I stopped right there, and I went, wait a minute. This event was experienced by the same event by two people. They had 180-degree opposite reaction.
Yeah,
interpretation.
that's amazing, though, to think about that.
and so I started to look at that, and I started to look at the literature on perception. And this is everywhere. If 10 people see an event, there's 10 different interpretations of that event. They're all different.
Yeah.
Right. And so I started to say, you can choose how you perceive the traffic. You can choose how you could beat yourself up because you didn't leave earlier, because that's ultimately the thing. And maybe you should have left earlier. Maybe you should have predicted it, but you're still beating yourself up over it. Right. Or you can say, I can't do anything about the traffic. And find things. The gratefulness is just something that you can use instantaneously to turn that. I also have something else called benefit of the doubt, a technique. In the benefit of the doubt, we're judging machines, I call it, right? We judge everything instantly. It's almost always a negative judgment that most of us have. It's not universal, but most of us do, right? So again, let's stick with the traffic example. You're running late, you're speeding, right, to try to get to some place, right? And there's a bunch of traffic, and you're in like the third lane from the right, and someone from the left lane speeds, cuts you off, goes across 3 lanes of traffic and exits at the exit. And your first reaction might be judgment, like, oh my God, you son of a bitch, I can't believe you crazy driver.
Yeah.
You almost hit me. What did you do? Right? Again, what's going on? Bad things are going on inside. Okay. Now, that's one perception. You could also you could have done this, but you can still do it after. That's the thing I like about all of these, even gratitude. You can do it at any time. You can say, there was a hospital sign at that exit. I didn't even notice. Maybe his son is in the emergency room and he's trying to get to the ER. Because if you knew that, you would have stopped traffic to help him get over.
What an unbelievable thing.
Same situation. You don't know what the whole thing. But ultimately the thing is, he doesn't even know that you're pissed off at him. You're not doing it for him. You're doing it for you.
And that's the key,
yeah,
right?
That's the key.
It's one of those things that you really have to stop and consciously think about it, because your reaction, as your point, is they don't know that this has upset you.
He may not have even seen you.
Right. And so the only person that this is really bothering is now you.
Yes.
And going through the conversation, do it enough, and it has the potential to cause negative health consequences.
But we're even better at it, because we not only, so that's that interaction causes bad things, but then we play the victim role. We hold on to it. And when we get to work, we start telling the story. And every time we tell the story, he was a little bit closer. And you get to a point where he was like, I think he even maybe like hit me, because you're always kind of got to play it up a little bit, right?
Yeah.
And the more you hold on to it, the more detrimental it becomes.
Well, so I love these are two great things, right? So being able to look at being grateful is a good way to calm the situation and really start to think about how
Works
good
instantly.
things are,
Yeah.
right? And then the second, giving people or giving the situation the benefit of the doubt. At work, we always we use a term with a phrase with our senior leadership team that is assume best intentions,
Yes.
right?
Yeah.
And we
That's the
we
same.
say that all the time
Yes.
because people are not
Yes.
intentionally
Yeah.
doing things to make it
Yes.
terrible.
Yeah.
And it's a really good thing when you're talking about a team of people, right? Because you really, I think you're all kind of going towards the same goals. And so people may do things that they think are best decisions that you may not agree with.
Right.
But when you start to step back and say, but they were trying to actually do something good, it makes it different
Right.
and it de-escalates the issue. So I think that that's two really, really good points. The reason I bring those up though is because, if you're listening to this conversation and you're trying to figure out, okay, now I understand that the way I think about things has a physical response. This physical response held chronically can cause health issues. So I don't want to hold on to this physical response. How do I start to change my mind? So then we think about being more grateful in the moment. We think about assuming best intentions or benefit of the doubt as ways to really start to take control of our thought process and get ourselves in a much better spot.
Yeah, and there's other things too. Like with some of the things we do naturally, like a sigh, right? Like if something's going on right there, and somebody will see something, you just go, like they do that. They weren't taught that, but that does elicit the relaxation response. So even if you don't sort of change the mindset, if you stop and you take a deep breath, a slow deep breath in, and you let out a sigh, and then stop again and do that a couple of times. Again, it only takes 10 seconds. You can even do it in the middle of your board meeting, right? Right. And so those are if you just make people aware of that, right, that they have techniques that they can do even at that moment. Yes, if they can leave or and go sit in a quiet room for 5 minutes, that's even better, right? But that's what a smoker would do, right? A smoker would go leave.
Oh, that's a fair
He'd go
point.
to a nice little area that they have set up for them, right?
Yes.
And they would sit, and if there's no one there, they have a little 10-minute meditation,
Yeah.
right? If there's more than two people there, they have a support group. because you used to see this at the hospital all the time. Like you'd go to the little smoking area. It was this beautiful little patio area. They'd be sitting out there, and there would be like a nurse, an orderly, a secretary, and the CFO. Four people who would otherwise never get together, and they would be sitting out there, and they had a support group because they were saving the world there or whatever, right? Doing their thing. So the worst thing that happens to smokers, I think, is if they quit smoking and become non-smokers, they don't keep taking that 10-minute break every hour and a half, which I would encourage them to leave their desk, go sit not in the smoking area, find some other nice area, and sit there for 10 minutes.
And that actually points out the benefit of being able to talk to others in a similar situation, because support groups do a wonder when it comes to
The
that.
literature on support groups is unbelievable. I'll give you an example. Women with breast cancer who go to support groups live 50% longer than women with breast cancer who don't go to support groups. You know what percentage of women go to support groups?
It's probably in the 20s, maybe.
It's less than 15% that
Oh, wow.
start that continue going. It's like infinite. It's really small, like less than 5%. Even though it's offered, So again, we offer these things, but the physician doesn't encourage it. Doesn't say, "Hey, are you going to the support groups and stuff?" It's just kind of, "Oh, we have this, and this," And some women start and then stop.
Well, first of all, that's unbelievable. But second of all, like it seems like it's one of those things that it needs to be publicized, right? Like we should be thinking about those types of things in a way that we're not thinking about them today.
Yeah. So I mean, the sad part is we both know if there was a chemotherapy drug that made women live 50% longer, how many would get it?
You're right.
Not 100%.
Yeah.
But most of them, right?
Yeah.
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 And so that's the thing. Those are the things I think we need to change. I don't have a problem with the chemotherapy, right? But my wife had cancer and she was going through the chemotherapy. I did a gratitude recording for her. She would listen to this recording while she was getting chemotherapy. She did it every day, but while she was getting the chemo, and it basically took her through the whole system from her doctor and appreciate his knowledge and diagnostic knowledge of the chemotherapies, the nurses, that they knew how to start the IVs, they knew how to administer the drugs, the technology, all the diagnostic technology, the radiation. When you walk into radiation therapy, it's a scary thing. It's this big, scary machine, and she would walk in with that appreciation, and amazing things happen. Like, she never lost her hair. They told her she would lose her hair like after the first dose. She never lost her hair. I can't say that was due to I can't say any of this was due to the gratitude, but it put her in a position where most people, when they go in for their chemo, they're anxious, right? They're stressed, they're fearful, and all this kind of stuff. And this gave her something else to think about. Because think about it, you're laying there getting your chemotherapy. The chemotherapy can take 3 or 4 hours to get. You're laying in this uncomfortable bed or this uncomfortable sort of chair. And, as you're laying there, your thoughts start to run away with you, right? So maybe your back starts to hurt because you're laying there and you go, oh, my back's hurt. Let me turn away. Oh, yeah. Oh, breast cancer can go to the back. Mary had breast cancer, and I went to her spine, and she had all this back pain. Maybe I've got it in my spine. Now it's probably all over the place, right? So your thoughts run away with you. The gratitude is one way to stop those runaway thoughts. And wait a minute, I'm grateful for this medicine and letting it in my body in a grateful way, which is different from positive. This is different from positive psychology. It's not saying this is going in and doing me good. You're like, let it in this grateful way, saying, go and do the things that you have to do. Leave all the other stuff alone that you don't have to touch, whatever. And she didn't have all the side effects she did, and she had metastatic breast cancer, and that was cured. She lived 15 years after that. So was it due to the gratitude? Again, I'm not going to say that, but it certainly helped her from a mindset perspective a lot.
So as we think about all the topics that we've covered, because that's an incredible story, and I think it speaks to some of the things that we were talking about earlier, and really having to take that responsibility to be a participant in your healthcare experience.
Yeah.
If people are listening and they're like, wow, this is the conversation for me, it's what I really need to focus on. How do they learn more about you? And if they wanted to get in contact with you, what would they do?
So I started this company called Gratefully Well, and the idea again was to transform what I did one-on-one to this digital space. I didn't want to practice medicine online because that's not my interest. So this is really an educational thing, and I'm still working at trying to figure out exactly what that looks like. So I started a newsletter on Substack.com that's called Gratefully Well, and that lays out the principles here, and then ongoing we'll give examples and things like that. So, and that's a free newsletter. So I encourage people to subscribe to that. I wrote a book also that's available on Amazon. That's about the evidence that exists for the physical and mental health benefits of gratitude. I've got a second book coming out because that one doesn't deal so much with the techniques of gratitude. So there are a lot of techniques out there, but again, some of these things like the intentional gratitude using the traceback method, I think can be very powerful. So the second book, which is not going to be on Amazon, will probably be sold through the website, and it'll be a low ticket kind of thing, like a $7, a book or whatever. That'll probably turn into some kind of video course or something. And then I'm going to start doing workshops. So I've done a couple of workshops that are free. The workshops introduce the concept of Gratefully Well, and then introduce some of these concepts of the mindset, and then some tools. And then probably what I would like to do is develop closed group workshops. So groups of 10 to maybe 20 people that meet every week for some period of time, let's say 4 weeks or 6 weeks or something like that. And we go through the whole sort of program. And those will be coming up. I'd like to start them before the end of the year, but certainly by the end of the year, I'd like to be doing that as well. They can go to the website, gratefullywell.com. There's a free 7-day gratitude challenge there. So you sign up for that, and you'll get every day you get basically an exercise, a gratitude kind of exercise and challenge. And that exists as well.
Well, I will make sure that we link all of
That'd be
those
great. I appreciate
in
it.
the description of the show. That way people have access to it and can come back, listen, click, and find the things. I got to thank you for spending the time. I think this has been great. And there's so many things that we talked about that connecting the dots becomes really, really cool when the light comes on and you start to figure out these things that go together. And I think you do a fantastic job of helping us kind of connect those over time. So again, thank you.
Well, thank you. I appreciate the invitation and appreciate seeing your place, and it's great. And thank you.
Well, I'm certainly going to keep in touch with you,
Look
and it
forward
would
to it.
be kind of cool to do more of this conversation
I'd
over
love it.
time if
I
you're
would
open
love it.
to it.
I'd love it.